My name is Ariel Lanada, Chairman of the BAME Staff Network at Oxford University Hospitals NHS Foundation Trust. I am delighted to tell you that I am receiving my first dose of COVID-19 vaccine on 27th January. I am really grateful to the NHS for this free vaccine that will protect myself, my friends, my loved ones, and my colleagues. I lost a few of my friends from COVID-19, and there is no way that I am taking the risk of not having this vaccine. COVID-19 vaccines are the product of intensive clinical trials and have met the highest standard of safety and effectiveness. Please take your COVID-19 vaccine when it is offered to you. Together, we can save lives. Together, we can protect the NHS. Together, we will defeat COVID-19. This is it. This is the moment that I am waiting for. I am Ariel Lanada. I'm the chairman of OUH BAME Staff Network and chairman of the Filipino community of Oxfordshire, and also the president of the Filipino Nurses Association of United Kingdom. Now today is a history for me because today I am receiving my first dose of COVID-19 vaccine. And I am appealing those who have not received their COVID vaccine yet, please take your vaccine once it is offered to you. It is one way to protect ourselves, to protect our loved ones, our friends, our colleagues, and the public. So please take your COVID-19 vaccines.
Really floppy arm, very floppy arm.
Okay. Excellent. So there we have it. I've received my first dose of COVID-19 vaccine. Thank you, OUH, and thank you, NHS, for this free COVID-19 vaccine. Thank you.
It's an extremely tough time for everyone at the moment, but I think there is some hope, and the hope is a combination of the different factors that we have that can help control spread of the virus. One is vaccines, which we're talking about today, and obviously all of the other physical distancing measures, which clearly are the thing that's having the impact at this moment. One of the real questions about the vaccines is how long after you've had the vaccine before we might start seeing protection. And what we've seen in the trials that we've done of the Oxford vaccine is that from about 2 weeks after the first dose of infection, no one in the trials was admitted to hospital or got severely ill. From the biology, it's clear with every vaccine that we study that if you space them further apart, you get a much better response to the second dose. So the spacing of vaccines that was recommended by the Department of Health following advice from JCVI is entirely consistent with what we know from vaccines we give to babies, vaccines we give to adults, that if you put them very close together, the response to the second dose is not as good as if you space them apart. And from the trials of our vaccine, we've seen that if you have a 1 month gap between the two doses compared with a 3 month gap, the 3 month gap gives immune responses that are about 3 times better after the second dose than if you do a 1 month gap. For the Pfizer vaccine, we have less information about the spacing because they didn't do their trials in that way, but biology doesn't change. It is still going to be the case that having the second dose as a later boost will give a much stronger response afterwards. For those of us who've had 1 dose and are desperately waiting for our second dose, it feels like we're being somehow cheated. But I think the way we should look at it is that we're donating that second dose today to someone whose life we might save. But in the long run, we're still going to get it. It's still going to be provided for us. But with neither of the vaccines available, is there a particular biological reason to be worried about vaccination in pregnancy? And that's why the current government advice is that if you're in a high risk area, then you should talk to your clinician but it's likely that balancing the risks against the benefits, that vaccination is appropriate, even in pregnancy. But there isn't any particular reason, apart from the fact that people will have immediate side effects in the first 1 or 2 days after vaccination, where they'll have a sore arm and they might feel fluey, might even have a temperature. Those are the issues with vaccination. There's no evidence that there is any potential risk to the fetus or to the pregnant woman beyond that sort of systemic reaction that happens on the first day. The other question around pregnancy that people have asked frequently is, if I'm vaccinated, is it safe to try and get pregnant afterwards? And there's quite a lot of data from all of the vaccines about this, because of course in the trials, which are very large, there are many people who have become pregnant. And so in our trials in the 3 countries we're working in, there are many pregnancies which are progressing. But obviously we have to follow those up right until after the baby's born. But there is no signal that's worried the regulators at this stage in the clinical trials of people who've become pregnant during the clinical trial period. Well, both of the vaccines actually have a fairly similar spectrum of side effects. The Oxford vaccine, it is, I guess, like having what feels like a mild viral infection. So people tend to feel fatigued. They might have some muscle aches and joint aches. They may have a headache, and some people that's been quite prominent. Very few people get a fever, but some people will have a fever with it, and some people feel shivery even though they don't actually have a fever. And this is a common set of symptoms with both of the vaccines. So the recommendation is that the second dose is given with the same vaccine as the first dose was given. And that's because that's how the trials have been done. But if you were in a situation where you are ready for your second dose and the only vaccine available is the other one, it's better to take that appointment and have the other vaccine than it is not to be immunised. And that's where the current recommendation is. So in exceptional circumstances, it's fine to mix. A huge part of the challenge at the moment is to get high enough coverage to really start seeing the vaccines making a major impact on hospitalisation and severe disease. And that, as we know from the various government briefings, is going to take some time.
If you're ready and eligible and are invited to take part in the vaccination program, then that is essential that you do so, because it not only protects you, but it also protects those around you and the confidence with which you're able to deliver care to our COVID patients.